Hi, I'm Bob, and I'm an alcoholic. More specifically, I'm Bob Reese, and I'm a professor of psychology, and I've been in recovery since 1991. I'm also on the research team of the International Quit and Recovery Registry. It's better known as the IQRR. You can see my recovery story near the bottom of the homepage of the IQRR website at quitandrecovery.org or on my personal website, drbobreese.com. My research interests are focused on the positive psychology elements of recovery. In other words, how to help others thrive in recovery. With that in mind, I've recreated some recovery tools videos that have been modified from the topics that I teach in my online psychology courses and that I have outlined in my book, The 13th Step Thriving in Recovery. Enjoy. Our primary focus in this recovery tools edition is on visualization. And just to make sure we're all on the same page about what that means, visualization is imagery, it's mental practice, creating or recreating an image in your mind, using your imagination, daydreaming, but with a purpose. So some people say they can't visualize, but everybody can visualize. If you dream, if you imagine things, then you visualize. I once had a client who said she couldn't visualize. So as we were sitting there, I asked, she had just gotten a new apartment. And so I asked her, to tell me about the apartment. So she started telling me, and I was said, so so draw it out for me here. I pulled a little piece of paper out and had her sketch it. So she kind of sketched a blueprint. She said, of course, this isn't to scale, and but that's kind of the layout of the apartment. So when she was done, I said, well, how did you know what to draw? She said, well, I just knew that's what it looked like. And I said, well, that's visualization. You don't actually have to see the Kodak picture. In fact, some people, myself included, uh, are not good at visualizing the actual image. Over time, I've learned, and you can certainly learn how to visualize better. To make sure that you know how to visualize, I'm going to send you to your room. Whether you physically go to your room or you just imagine it, then go find the room that you spend the most time in, your favorite room in your house or apartment, wherever you might live. And imagine yourself sitting there. And first thing I want you to do is close your eyes and count the number of windows in the room. So as soon as you've got those counted, then open your eyes. And could you actually see the windows in the room? If you could, then you have no trouble visualizing. If you just if you just knew they were there, if you had a sense that they were there, then while even though you didn't have that Kodak moment or you couldn't actually see them, then you were still visualizing. Okay, so now let's make it a little more sophisticated. I want you to imagine you're sitting in a chair or you're on your bed in your room, the room that you like, and close your eyes. And I want you to visualize what's on the wall in front of you, the wall that you're looking at. What's on that wall? Maybe there's a TV, maybe there's bookcases, could be vases with flowers in them, or a picture, but whatever's in there, get a sense of what it is. If you can actually see it, that's great. Uh, if not, get a sense. But once you have a sense of that, then I want you to look at the wall on the left hand side, on your left hand side. So what's on that wall? It could be a door, a closet, steps, whatever's on that wall. Pictures, get a sense of what's on that wall. Now, once you've done that, then I want you to look at the right-hand wall. Get a sense of what's on that wall. Maybe it's a fireplace, could be a window. What are the window treatments? Are there curtains? Are there shutters? Get a good sense of what's on that wall. Now, once you've done that, we're going to do something a little more difficult. I want you to see the wall behind you, but I don't want you to turn around. I don't want you looking at it. You know what's on that wall. So describe to yourself what's on that wall behind you. Maybe it's a hallway. Maybe it's the door to the room. Is it paneled? Is it painted? Does it have wallpaper on it? What does the wallpaper look like? All of these things you know. So now once you've done that, and if you want to, you can pause the tape and try it again on your own. But our next step is I want you to open your eyes and come back again to the present. And then I want you to imagine up in the left-hand corner of the room, in the corner at the top where the ceiling meets the wall, there's a video camera. And I want you to take the camera's view of you. So in other words, you're going to be looking as the camera sees you. You're going to see yourself in the chair or on the bed doing the visualizations. So this is a little more difficult, but you can, with practice, you can do this. So close your eyes, try it out. See if you can see yourself sitting there visualizing. Now, that's the difference between the first-person view and the third-person view. The first-person view is what you were doing before. It's the internal view. It's what you actually see. The third-person view is an external view, and you can see yourself. I've used this with athletes in the past, golfers especially, so that they can actually see themselves swinging the golf club without me being around, so they can pick up if there's something wrong with their swing. I've used it with track runners to pick up why they may be slowing down. It can be a very effective thing, and it will help you in your sobriety. Visualization is a mental skill. It gets better with practice, just like a physical skill. So what you want it, if you want it to be effective, you want to do it systematically. You want to do it purposefully. And we will eventually be combining it with goal setting, using end result thinking. We'll do a little of this in this video, but I'll have a separate tool for that later. I like to tell my clients, if you can see it, you can be it. So keep that in mind as we move forward. I mentioned end result thinking. So one of the many sayings in 12-step programs is think through the drink. And if you combine this with visualization, that's what you're doing. You're thinking through that. You see yourself on the other side of that. One of the other sayings is, one is too many, 1,000 is never enough. But I want you to keep in mind that we're talking about visualization. So if you're new to sobriety, if you're new in recovery, can you see yourself, can you picture yourself being sober or being clean? Can you see yourself not drinking or not using? You got to be willing to change your drinking or using habits. You got to be able to say no to a drink or a drug. Okay? Can you see yourself doing that? And when you can see yourself doing that. It won't be easy. You won't be having fun. But can you picture yourself feeling good about not using, about not drinking? Now let's move on from sobriety to recovery, because being sober is different than being in recovery. Being sober is just not drinking or not drugging. It's just being clean. Recovery is more than being sober. Okay, it's the healing process. You become better or well mentally, physically, emotionally, spiritually. Now this is work, and see if you can see yourself being in recovery long time, okay, for a long period of time. Now, a lot of the times you go on websites and they show recovery and they have people jumping for joy. I couldn't see myself jumping for joy the first year or two that I was in recovery, okay? So recovery for me looked more like just being serene or grateful, content, being productive at what I was doing, not waking up with a hell of a hangover, okay? So these are, can you see yourself being in recovery? Visualization helps us imprint that vision in our subconscious. The more often you do it, the more effective it becomes. As I mentioned before, it's a skill. So you practice it. If you can do it 10 to 15 minutes a day, that's great. You do not have to do it all at one time. When you wake up in the morning, see yourself in recovery. See yourself being sober. See how you want your day to go. You can use the visualization for that. We'll talk about that when I do the tape on goal setting. At lunchtime, at break time, when you get home, take a couple of minutes. See yourself doing it. If you're getting ready to go somewhere to meet people, see yourself being sober. See yourself in recovery. I tell my clients and my students, if you can see it, you can be it. So if you can visualize yourself doing these things, you certainly can do it. Emotion plays a big part on what gets imprinted in our brain. We'll have a separate video tools video describing the power of positive emotions later. But one thing I want you to keep in mind is that emotion and imagination always win over logic and reason. Okay, our emotion will trump logic and reason all the time. With that in mind, I want to talk about feelazation. Now, feelazation is a term that I coined when I was trying to work with athletes, getting them to add emotive imagery to their visualization. So I kept telling them emotion, and one of the players finally said, "So you want me to feel it?" I said, "Yeah, I want you to feelazize it." Okay, so feelazation is the anchoring of a powerful emotional component to a vivid visualization. Now, the reason it works is it combines three areas: emotive imagery, which was studied early on in sports psychology by having a weightlifter lift his maximum weight and then get angry and lift again, and they could lift more tapping into that anger. Now, I don't want you getting angry, but you can use positive emotions to tap into that, to your imagery, and make it stronger. Then there's this concept of felt sense. Now, this comes from Eugene Gendlin, who's a psychologist, and he developed what he called focusing. And the felt sense is finding in your body where you can feel that emotion. Okay, you may end up feeling it in your belly and your heart, your throat, your head, all over your body, but you develop a felt sense of that, and that will come with time. You'll be able to feel that, and then when you get that emotive imagery and that felt sense, I want you to anchor it. You anchor it with a cue word or phrase. It can be any of the 12-step phrases, one day at a time, take it easy, whatever it is. Or you could just say a recovery. And then physically anchor that by, I like to have my clients squeeze their fist. You can do it less forcefully, just rubbing your thumb and forefinger together, but you need a cue word or phrase and a physical anchor so that you can call that feelization back whenever you need it. So first, I want you to get in a nice, relaxed position. If you're seated, place both feet on the floor. Then close your eyes and begin by visualizing. I want you to think of a time when you were very happy, when you were ecstatic. It could be a recent time or a time much earlier in your life, even when you were a child. It could be a time when you had a great birthday or Christmas and you got a great gift. Or you won a competitive event or were on a winning team. Perhaps when you got your first car or the job that you've been dreaming of. Maybe when you got married or had your first child. I want you to think of something really special and then get that time firmly in your imagination. Work to visualize as much of the experience as possible. Get into the details of the event. When you've achieved that, then just be in that moment for a while. Really feel the joy. Feel the happiness. Let it soak in. Now, can you feel that joy, that happiness in your body? Get a sense of that great feeling in your body. You might feel it in your stomach or your gut. You might feel it in your heart or your chest. You might feel it in your throat or your head. You might even feel it throughout your entire body. There's no right or wrong place to feel it, but feel it in your body. And then once you feel it, I want you to name it. Choose a name that is meaningful to you and is easy for you to remember. Now say that name and anchor it by squeezing your hand into a fist or by just rubbing your thumb and forefinger together. It can be anything physical that is comfortable for you and easy to remember. So anchor that feeling. Once you've named it and anchored it, know that you can return to this place, this feeling, at any time in the future by simply getting relaxed, saying the name of the event, and firing your anchor. It will get easier and easier to recall and return to it each time you do it. Now, if you had a challenge getting the felt sense in your body, just know that with a little practice, you'll be able to do it. So I like to say, if you can see it, you can be it. If you can feel it, you am it. So I want you to be able to see yourself in recovery. And how does that feel? If you can get that feeling, anchor it and name it also. So you might be saying, okay, Bob, I felt it in my body. And yeah, that's kind of cool. But how can I use this? Because I'm not doing it just to show you something that feels good. Use this when you get in trouble, when you start feeling challenged, when you've got the temptation or the craving to have a drink or to drug, okay? Now, the thing is, it's just like stress management techniques. You have to practice them when you don't need them so that you can call on them when you do. So if you practice this to where you've got the anchor and the name, and you can get that feeling. If you're out somewhere, you're at a party, somebody's offering you a drink, somebody's offering you a drug, could even be a cigarette. Maybe you decided to quit smoking. You know, then you fire your anchor, you say the name, and you get that good feeling of what it is to be in recovery. And then you either get the hell out of there, call your sponsor, or find somebody to talk to. But you can. This is how it can work for you. That does it for this edition of Recovery Tools, the visualization and feelazation. Now remember, you've got to practice these things to be able to use them effectively. You can find out more about visualization and feelazation in both of my books. Again, you can get them on Amazon. The electronic copies are very inexpensive. Remember to please keep taking the assessments. Stay active on the IQRR website. Go there at least once a month when you get the notice about a new assessment. Take the assessment. That helps us help others and allows you to become a recovery hero.